Welcome everyone to today's webinar in Elevating Health and Safety in Energy Efficiency Programs. I'm really looking forward to today's discussion. But before we begin, let's go over a few housekeeping items. There's different audio settings in your GoToWebinar control panel. If you're having the computer audio is usually the best audio, but if you are having issues, you can select the call-in number, and you can find that in the audio settings. We will have a time for a live Q&A with our panel today at the end of the show. So go ahead and type in your questions as we go along, that way you don't forget them, and we'll get to them at the end. So yeah, answer your questions so we can have a robust Q&A. And today's session is being recorded. You will all get a copy of the recording next week. And, we're almost a month away from our 2024 CLEAResult Energy Forum Conference. So I want to give a quick plug so those of you on the call can still get your travel arrangements together. This year we have something really special in store in the lush tropical gardens of the 44-acre island at Paradise Point in San Diego. There will be engaging sessions, roundtables, professional development workshops, and I'm personally really excited for the luau. It's going to be a lot of fun, and it's going to be really engaging. And like I said, it's shaping up to be an incredible experience. There's no registration cost. It's on us. Attendees just pay for their flights and lodging at the Paradise Point Resort. So to learn more, visit the link in the chat or email us at brand@clearresult.com. So this event, it'll inspire, engage, and connect you with the future innovators driving clean energy forward. So do give a thought to attending. I know I'm excited. So without further ado, let's get to today's show. It's my pleasure to introduce Rebeca Barrios-Hurst. She's the Senior Practice Consultant here at CLEAResult and going to be our host for today's show. So Rebeca, I'm going to hand it over to you.
Thanks, Nick. I would like to take this opportunity to review our agenda, which is on the left-hand side of your screen. For today's webinar, we're going to begin by doing an introduction of our panel, which I'll do in just a minute. But secondly, we're going to learn about what social determinants of health are and what they have to do with energy efficiency. Thirdly, we're going to learn a little bit about what AES Indiana is doing in this space, and we're super excited to hear from Adam about that. And then finally, we'll talk about leveraging health and safety dollars and how do we pay for programs like this. But first, let me take the opportunity to introduce our esteemed panel of speakers for today. First, we have Adam Hammond. He is a residential customer program manager for AES Indiana. AES Indiana is the electric utility provider for the greater Indianapolis metropolitan area. That's a mouthful. Try to say that 3 times fast. Adam oversees the delivery of several programs, including efficient products, income qualified weatherization, multifamily, and green power. And Adam has multiple degrees and certifications in building science, industrial electrical, renewable energy, and wind energy systems. So welcome, Adam. Our second panelist is Chip Amo, who is a sustainability officer for the University of Michigan Health, Michigan Medicine in Ann Arbor, Michigan. Before joining U of M Health, he served as Director of Sustainability at Michigan State University and was the first Director of Sustainability for for Henry Ford Health Systems in Detroit, Michigan. He is originally from Michigan, but he received his undergraduate degrees in political science and consumers affairs from the University of Rhode Island and his law degree and Master's of Public Administration from the University of Pittsburgh. So welcome, Chip. And finally, I want to welcome Karen Zinda. She is a Director of Community Health Planning and Investment at the University of Michigan Health, Michigan Medicine. Karen has worked in public health programs, evaluations, and research for over 15 years. She is passionate about making it so that everyone can experience good health throughout their lifespan. So welcome, Karen. Can we go to the next slide? Awesome. So what we're going to start off doing is learning about what the social determinants of health are and their intersectionality of energy efficiency. But first, I want to hand it over to Chip and Karen to talk about what are social determinants of health. When we say that, what does that mean, right? So I'll turn it over to you two.
So much, Rebecca. And it's nice to see everyone today who joined us. So one thing about social determinants of health is, as we like to say, just throughout public health and programming, is these are the conditions in which we live, work, play, and pray, or are born and die in. So these are the things that affect our health that aren't just us going to the doctor or us what we eat or how we exercise. It's our education, it's our social support, it's our income level, it's what kind of community cohesion we're in. Like, do our neighbors support each other? Do we have a group that we belong to? It also includes our health behaviors and our health care. And if you look to the person here on your right on the screen, you see that our socioeconomic factors, which are one piece of social determinants of health, are 40% of kind of what affects your health. Physical environments, approximately 10%, but a lot of your physical environment is affected by some of these other factors. 30% are your individual personal health behaviors. But when I say health behaviors, these are also affected by what you have access to. Do you have healthy food access? Do you have people who are supporting good health behaviors around you? Do you have access to support programs if you're trying to eliminate some unhealthy behaviors? And then the other 20% is healthcare. Um, but one thing I want to emphasize is these factors are so important that here at Michigan Medicine, one thing that we've done is we've started screening over the last 8 years, at least once a year with patients in our primary care. And now we're screening and expanding our screening to both inpatient. But we actually go through several of these determinants of health. We make referrals out when there's an immediate need. If there's not an immediate need, we make referrals out. Just to people. We also have a platform where we encourage our patients to utilize if they're looking for a resource, but they don't want to ask for help from us. And so we recognize that we are only one piece of the pie. And so we need to make sure that we're helping our patients in the whole spectrum of care.
Yeah, Karen, I really love this graphic because it shows that only 20% of this is actually healthcare, right? So I appreciate that. I'm sorry, Chip, go ahead.
Yeah, no, I was just going to emphasize the exact same point is that, just really to put it a better way. So when you think about it, 20% of all your health is determined by the health care you actually received in your physician's office, or, the hospital. The rest of it is all based on your social determinants. And so what we've seen over the, last probably decade and even more though, but really I would say in the last 5, 10 years at the most, an increasing emphasis on trying to address these social determinants of health in everything that we do from a health system. So that includes our programs. And as Karen mentioned, a lot of health systems are going to a process where there's actual social determinants of health screening. And then the challenge that we have, and I think we're going to get into this in a little bit, is how do we then best address those issues for our patients when we know that they make up such an important part of their overall health picture. So I think Karen's going to talk a little bit about the kind of how we're framing things at University of Michigan Health.
Thank you. So one thing I wanted to, I'll build on top upon that Chip just said is that we've actually been for, I want to say 20 plus years addressing the social determinants of health through some of our outreach programs through community health services. And one of the things we've been looking at is looking at the factors or the categories that social determinants fall in, because as you saw, there are many things that factors. So the CDC or the Centers for Disease Control and the Healthy People 2030 model have kind of set these 5 categories as how we categorize or think about social determinants of health. So it's your education, access, and quality. So, are you in good schools? Like, do you have people who are encouraging you to attain, high school and post-secondary education and training? What quality is that? What resources are embedded? healthcare and quality, because healthcare might only be 20% of the pie, but we need to make sure people have good quality care when they're there so that that 20% is great. Neighborhood and built environment. This is where a lot of the energy, um, and a lot of people on this call might sit, because our neighborhood, our built environment, our homes that we sit in, the air quality we breathe in our homes, are our homes energy efficient, sit in this neighborhood and built environment category. We have social and community connections. And so that's, do you feel connected to your community in some way? It could be connected to your neighbors. It could be connected to your spiritual community. It could be connected to your friends that you've had for many, many years. But having that context where you're supported in some way by others and you support others, and contribute back. And then economic stability, because we know that if you are paying a lot of money towards different levels, or you don't have enough money to support all your basic needs, that it's hard to have good health, because it's hard for you to pay attention to other things in your life when you're not making ends meet. So I know that Ray put in the chat, if you guys are curious about what different things fall under the categories within these. And then Chip is actually going to talk a little bit about various different um, programs and things that fall into these categories that are related to energy efficiency and programming.
Yeah. So from the health systems standpoint, as I mentioned, we do a social determinants of health screening tool to identify places where people might not be having their social needs met. So it's everything from screening questions of um, do you have access to food or healthy foods? Do you have trouble paying your utility bills? Do you have housing issues or issues where you're feeling unsafe in your home or your neighborhood? Um, a lot of these factors, do you have access to transportation to get to work? Do you have a job? All of those things we screen for. I think the challenge that we've had, with healthcare in general as an industry, and not speaking specifically for University of Michigan Health, but as an industry, is how do we then, when we identify these needs, how do we then address them? Where do we send them? How do we refer them out? Because we're really in the business of treating patients that walk through our door, and not so much traditionally in the business of how do we address people's needs in the community and doing that. And so as Karen mentioned, hospitals have been pillars of the community and anchor institutions in the communities that they live for many years, and they've been engaged in those. And what we're seeing is a greater trend towards aligning those efforts, aligning those community investments and those projects where we're partnering with other groups to be able to set up those networks, so that when we do identify areas for opportunity, that we have a place to put them. As somebody who does sustainability for a living for the health system, one of the things that I've really tried to do in my roles is figure out how are we addressing sustainability in those other areas, so that we're not just referring patients to something out there that's not going to have any impact, but how are we going to not only impact their social needs, but also address sustainability, which, as we know, climate change is becoming the greatest threat to human health that we face, whether it's from warming planet, and we're seeing it, on the economic side too, when we talk about paying higher prices for utilities. Heating and cooling costs have gotten more expensive because of the extreme conditions of weather, which drives up costs. So how do we address these things? So we're really putting on our caps and trying to say, how do we get twofers out of the work that we're doing, where we can address both the sustainable aspects, the health aspects, and address these social determinants as well. Where it presents on the housing side is, we know that conditions within the home have can greatly impact human health. So if you have mold or pests or leaky roofs or leaky windows, that all of those things can contribute to poor air quality, to mold. The built environment itself, like lead paint in homes, obviously a major problem for children. water that's not clean or running, or due to water shutoffs are all problems. So we are looking at that from more of a holistic standpoint. How do we make those referrals a little bit more? And so there are programs out there, and CLEAResult is demonstrating some of those that are really looking at that more from a holistic standpoint. And I think Adam is going to talk a little bit more about some of the programs that they have and how they fit in.
So in this slide, this is a question that we asked, University of Michigan Health. We said, what are some of the ways that energy efficiency can fit in? And I was wondering, Karen, can you walk us through this slide?
Thanks, Rebecca. Yeah, Chip went through quite a few of these already, but what we did is we correlated examples to each one of this CDC categories for social determinants of health. So some things in the healthcare and quality realm is like if there's improvements in indoor air quality, it can reduce doctor visits for those who have asthma or respiratory conditions. If you install things like HVAC system, more high efficiency HVAC systems, so heating and cooling systems into people's homes, you can lower utility bills and help produce both energy savings for the individual and for the provider of that energy. And then that helps keep people in a more stable financial position. Um, and then just a few others is when we partner with community organizations, we can help connect families, and we can also produce a more seamless process by if there's home visiting. We can also assess for energy efficiency and get more bang for our buck, and then create social connections by people not being isolated. Um, and then one of the other thing I won't, you all can read this, but we can also, um, if we help reduce people's energy usage and help reduce some of their financial stresses, this can help them achieve higher educational attainment. It can also help parents focus on those child's aspects without having to worry and stress about their home. And so then you kind of have a domino effect of higher educational attainment, higher achievement, and that produces better outcomes long term.
Yeah, thank you, Karen. I really appreciate that. So one of the things that very few people know about Chip and myself is that we belong to a triathlon group together. And one of the first times I met Chip, we had been cycling next to each other at 4 in the morning in a warehouse for months, and we started talking. And he just came to work, and he was super like, "I just need to know how we fix this for our patients, right? How we fix this long term. How do we make this sustainable?" Right? That was the term he used. And it made me realize as I was learning about the social determinants of health that Chip was part of my community, right? And the more that I hung out with people who are exercising, the more that I exercise, right? It's that transference property. And so when I look at these social determinants of health, you start to do what your community does, right? So do you live in a community that's walkable, right? Does everybody walk from place to place and go to the farmer's market? Or is it not a safe community and you're not able to go out, right? All that impacts your exercise, what you eat, how you eat. So I loved learning about these social determinants of health. And I remember that when I was talking to Chip, I was like, man, how do we fix this, right? At the time I was working at a nonprofit and we were laser focused on certain things, but we couldn't do all of this. And if we can go to the next slide, I will talk a little bit about what I learned when I came to CLEAResult, and that is um, Chip and I were like just chipping the iceberg on what the problems were, right? But people far smarter than me, engineers and program managers, they were already working on this. So it was very exciting to me to be able to come back to Chip and say, hey, so energy efficiency has this problem too, right? Their problem is a little different, and that is we were turning people away because we couldn't address things that needed to be fixed before um, we went in and did the energy efficiency work, right? And so what we did was we established this program that people could partake in that would address those problems first, and then offer them the opportunity to participate in our traditional energy waste reduction programs. Um, and so this is what we called Healthier Homes, or something similar to that. It was a program that we did, and it was awesome because we were be able to do things like look at air quality and address things like plumbing and foundation and asbestos and things like that that were actually making a difference. And so I was really grateful that Chip had put that in the back of my brain a couple years ago. And when I came to CLEAResult and found out about this program, I was like, Chip, I have this connection. We can do this. Um, and so one of the people that runs a program very similar to this, a little different, but very similar to this, is Adam at AES Indiana. And so can we go to the next slide? I would love, Adam, if you could tell us about what you're doing at AES Indiana.
Sure, thanks, Rebecca. So I'll talk a little bit about the history of our program, the evolution of it, our strategy, how it works, and kind of why we do it. So our Healthy Homes Assessment is an aspect of our income qualified weatherization program. We have been delivering our IQ program for around 15 years in one form or another. In the early days of the program, these were jointly delivered programs with other utilities, and we each contributed health and safety dollars into a bucket that was then transferred to the state housing agency. So through the course of an assessment, if we had a health and safety deferral, that customer would then get sent to the state housing agency for mitigation work and completion of services. So this was effective. However, from us at the utility, we didn't have great line of sight through the customer journey to completion. Following the sunset of those programs and those partnerships, we did move to standalone programs at the utility. And at that point, the health and safety dollars that we had previously allocated to the outside organization, we rolled those into our IQW budget and managed those funds internally. So the funds were used as needed for those barriers to weatherization, but we didn't really have any specific metrics around the use of those. So when I came to the utility a couple of years ago, I began to really take a look at those dollars and think about the strategy and how can we really maximize the impact of those dollars. And that kind of began a discussion with CLEAResult on how we would approach this strategically. So taking a look at some things that CLEAResult was doing with other programs, we decided to kind of model our Healthier Homes Assessment after HUD's Healthy Homes program, which is looking at those indoor air quality issues, those environmental triggers, et cetera. And then we really began to kind of set the stage for what we would do in 2023. So we have two main channels of participation. So as I mentioned, this is part of our IQW program. So we will have customers who come into the program through that channel. During the course of that standard assessment, our auditors may identify that there are some health and safety issues happening in the home, and then we can kind of take the next steps there. And that's pretty successful with our standard marketing channels that we use for our IQ program. But the other component that's proven to be a really great asset is expanding and developing a network of trusted community partners. Right. So we leverage local nonprofits, community organizations, neighborhood groups, houses of worship, also city and county offices to kind of spread the word and refer people into the program. And then over the last year, we've really begun to look into strategic partnerships with the local healthcare systems and partners. And this includes local small nonprofit medical clinics throughout the neighborhoods, as well as the larger healthcare systems that operate in our territory. So we are very blessed here in Indianapolis. We have 4 major healthcare systems that operate. And we had one of those systems last year approach us to be a referral partner on a grant that they were applying for. And how this really came about, they had done a study on social determinants of health, and they had identified that across our service territory, there was a 15-year gap in life expectancy between the low end and the high end. So they had identified the three zip codes with the shortest life expectancy and really began to dive into what was the cause of that. And so they began hosting community information sessions. I attended one of those. We had our standard, kind of like program literature table at that group or that event, and it provided us the opportunity to connect with the people behind that study, working for that healthcare system, and to start the dialogue, right? And like, hey, our goals are kind of aligned, so how can we partner together to be strategic about what we're doing? So as I mentioned, they had a grant for the CDC that they were applying for. They weren't ultimately selected for the grant this cycle, but we still both viewed it as a success because it really, like I said, opened that dialogue between us and them and began this partnership that we're continuing to grow today. So they have about 20 local neighborhood clinics. We have literature available in all those clinics. We have training that we provide to their social workers that operate out of those clinics. And then we host in-person events as well in their clinics where we can sign patients up to participate in our program. So that's been a great win there. And we're hoping to kind of take that and replicate that with the three other remaining healthcare systems in the territory. And then we've also had the opportunity, through like the braiding of funds with a neighborhood development organization who has approached us, and they know that we do assessments in their neighborhood. They own a significant stock in low-income rental housing in the neighborhood. They also provide for low or no cost interest loans for homeowners to do repairs in their neighborhood. So they're like, hey, we know that you guys are out here doing this work. We don't really have a sense of like what the need is in our neighborhood, in our community. So by leveraging kind of our aggregated program data that we've collected from all the homes that we've been in their zip codes over the last, several years, we're able to kind of give them a sense of like, here's what we see. Here's kind of the scope of the work. Here's what it costs to take care of these issues. And this helps inform their grant application and fundraising goals, right? So they know now, like, hey, when they're reaching out to, philanthropic organizations or applying for a grant, they really know, like, hey, we need to kind of hit this target if we're going to make a meaningful impact in the community. So I feel like that's been a really great success with those two organizations in terms of like, braiding the funding. But the community partner network is really key because those trusted partners become ambassadors for the program, right? They have the trust of the community. We as the utility often don't, right? And so if they're advocating for us, then we're able to just open the doors to more people. Next slide. So how we do this, eligibility for our program is based on income. It's 200% of the federal poverty limit. And when we're in the home, we're looking to see, does the situation meet the following criteria? So we want to know, is there a health and safety issue present in the home that's serving as a barrier to additional energy efficiency measures or services? Secondary, we want to know, is there a health and safety issue present that poses an immediate hazard to the occupants of the home or to the utility personnel or contractors who may be going in and doing the work, right? So an example of this may be, hey, they have unsafe basement or attic stairs, and it's not going to be safe for our contractors to be going up and down these steps to do the work, right? This is something that we could quickly address to take care of the issue. Another criteria we're looking at is there a situation in the home that, if left unmitigated, that may contribute to a negative health outcome for the occupant, which might reduce their ability to participate in additional programs or services, right? So another way to think about this is, does any occupant of the home suffer from a medical condition that would be negatively impacted if the issue is left unresolved? Poor indoor air quality in a home where the occupant requires breathing assistance, I think, is a common example of this. We know that it's difficult to schedule weatherization services in a healthy home, right? We're asking customers to commit to a significant investment in time. So if we have a customer who has health challenges and frequently may have asthma attacks or breathing issues and frequent doctor visits, it's very problematic for them to be able to schedule services for us, right? It's very low on their list of priorities when they're struggling to breathe. So if it's something that we can do as simple as like bringing an air cleaner to their house, providing a HEPA vac, maybe some flooring changes, right? That can reduce those indoor air quality issues and enable us to then like more reliably get back into the home to do additional services, then that's something we'll look at as well. We also want to look at whether or not the occupant is participating in any other programs that are designed to address or remediate these health and safety issues. Do they currently participate in, or are they eligible for any of these other programs? And then the nuts and the bolts of how it works, we go in, we do the assessment, we identify the scope of work, we get estimates from our contractor partners, and then we identify any of those coordinating services or programs that may be applicable in the situation. And then holistically, on a case-by-case basis, we look at, is the expense justified? Is it kind of within the scope of what we're able to achieve? And ultimately, is the work achievable? And at that point, we will, give permission to proceed, or unfortunately, in some cases, we still may have to defer just because the scope of the work that needs to happen is just too great. Next slide. So in looking at the last 2 years, in 2023, we had 65 participants. 32 of those qualified for the human health impacts. 15 of those qualified because of an immediate health and safety risk. And then 18 of those qualified just because of a primary barrier to weatherization. Now, there may be a combination of all of those situations in the home, but just kind of looking, at those stratification there. So from the work that we did, we were able to unlock an additional, 44,000 kilowatt hours in savings, which is pretty modest, but I still take it as a win because we're really looking to just like get our feet wet, kind of apply this strategy, get staff trained, and kind of look and refine our process. And I think if you look at the numbers for 2024, that really speaks to the progress that we've made just in the last year. We've had 61 participants year to date. 19 of those were human health impacts, 18 for immediate hazards, and then 34 for the weatherization barriers. And year to date, we've been able to unlock an additional 91,000 kilowatt hours in savings. We still have 3 months left to go in the year. So, I directly contribute this increase in savings to just learning from doing, gaining more experience, honing our approach, understanding what we can and can't do, and being more strategic about how we apply these funds. So on the right there, you'll see some examples of the things that we do. Bathroom ventilation improvements are pretty common. Fix, right? If we're looking to insulate in an attic, but the bathroom is venting directly into an attic, obviously that's a problem. You're sending all that moisture right into the attic. So we will vent that to the outside, go in and do the attic insulation, or there may be minor electrical repairs that need to happen in an attic or a crawl space so that we can safely get in there and do the work, making sure all the splices are within junction boxes, etc. We're not at the scope that we can fully, replace or mitigate knob and tube, but we will do those smaller electrical repairs as needed so that we can safely do additional services. Blower door testing, right? Mold is a problem for that. So we will do some mold remediation to enable us to perform blower door testing. Again, this is something that like the scope of mold remediation sometimes is outside of what we're able to do. It can range from a few $100s to, thousands of dollars. So we have to assess that on a case-by-case basis. Over the past year, we began using AeroSeal duct sealing as our approach to duct sealing for our income qualified customers. And so as part of that process, right, they're injecting the aerosol sealant inside of the ductwork. Those ducts need to be clean. So we will use, Healthy Homes dollars to clean the ductwork so that we can then AeroSeal properly inside of the ductwork. We also had a customer who had a chronically flooded crawl space. Every time we came out to do the work, to work in the crawl space, it was flooded. Right. And so they tried to, they had a sub pump, it wasn't working. They tried to take care of that on their own. Ultimately, they weren't able to do that. So for a really, not very much nominal cost, we were able to get a new sub pump installed, have an electrical outlet, at the point of use rather than them running an extension cord through the trap door and back into the house, which is what they had been doing previously. So we're able to get the crawl space dry, get in there, actually do the needed work, and then also minor gutter repairs to prevent the crawl space from flooding in the first place. Right. So those are some examples there. If you want to go to the next slide, just talk quickly about why we do it, why we feel that it's important. First and foremost, it's about reducing the energy burden for the customer. That is the point of our programs. And so there's a very obvious utility and ratepayer impact. We're reducing delinquencies on bills and defaults on customer bills. From the customer perspective, a lower utility bill means more money for food, more money for medicine and other essentials. It also means more money for savings, like an emergency fund or for long-term planning. We're all well aware, I think, that it's often difficult to make the choice to choose a more energy efficient piece of equipment or upgrade if you're just struggling to pay your bills. So if we're able to help relieve their energy burden and they now have the possibility to put money aside for savings, then at least when they come to make that decision to replace a piece of equipment, typically at the point of failure, they now at least have the possibility to consider that, hey, maybe I can afford to choose this more energy efficient option, which is going to save me money long term, right? Which further reduces the energy burden, and it kind of becomes that self-fulfilling loop, right? That's the kind of positive impact loop that we want to see. And all of this really does improve the quality of life. Reduction in food insecurity, the less rationing of medication is improving their overall health. There's improved health outcomes from a reduction in environmental triggers, less stress from financial insecurity. Less stress, improved health, improved comfort leads to a more stable home. It leads to greater personal confidence. Increased learning potential in children, increased productivity in adults, and ultimately it increases the sense of pride one has in their home. And I think that really leads to that final component there of stronger communities, right? Healthier homes make for healthier neighborhoods. Sustainable communities are more resilient. We're helping to improve grid reliability in those areas through demand reduction. We also know that customers who take pride in their homes also take pride in their neighborhood. So they're building and improving that sense of community. They're becoming, trusted ambassadors for our programs to their neighbors. Word of mouth is still our number one source of entry into our programs across the board. But then also, right, these stronger communities are safer communities. And so there's a reduction in publicly funded services, right? The burden on those services. There's a reduction in property crime, including utility property crime, like streetlights, et cetera, that may get damaged in some neighborhoods. Ultimately, this is increasing the safety for our utility workers when they're in those neighborhoods, right? They're going into those neighborhoods during power restoration, outages, et cetera, under very stressful, tense situations. So anything that we can do to help improve their safety when they're in those neighborhoods is a win for us. So that's kind of why we do it. And overall, it really kind of supports our core AES values of all together and safety first. And it's a win for everybody. So with that, Rebecca, I'll pass it back to you.
Adam, I love this because when we look at how people are able to participate in our programs, we often have situations where we have to walk away, right? And when we think about equality, it's everyone getting the same thing, right? But what I love about your program is that it's equitable, right? People are getting what they need versus um, getting the same thing that everybody else is getting. And your program is doing a great job of meeting people where they're at, giving them what they need. So now they have access into your EWR program. So I love it. Thank you so much. Um, at this point, I have a couple questions. Feel free if you have questions to put them in the chat, but I'm going to start off with some questions that I had for the three of you. And that is, the first question is, if I'm a utility and I am very interested in starting something like this, how do I pay for this, right? Like, how do we pay for programs like these? So I don't know, Adam, if you want to get us started, or I know
Yeah,
Karen
for
has something.
sure. Yeah, so kind of how I alluded to earlier, we had initially started this out with specifically allocated health and safety dollars, right, as part of a settlement for statewide run programs. So over the course of the evolutions of our contract cycles, periodically, it was agreed to in settlement that those health and safety funds would roll into the program budget. So I think that was kind of the natural evolution. So we now have those dollars earmarked within the program budget. So I think first and foremost, it's kind of understanding like what is the structure of your organization. Do you have an oversight board? We make decisions in conjunction with our oversight board and interveners on our filings. So we need to get their buy-in. That's very important. And so through that process, it was agreed to that we would earmark these funds to contribute to this work. I think the other component really is looking for partner organizations, right? So health systems, philanthropic donations, those don't have the same cost effectiveness criteria attached to it like we do at the utility, right? With us, our income qualified program isn't specifically required to be cost effective standalone, but the larger portfolio is required to. We still do try to make it as cost effective as possible, which I think is important in how we use these funds. We still need to show some results from it. So we are able to deliver a program that is near cost effective, and then within the larger residential umbrella is cost effective as a whole. So that's kind of how we approach it here at AES Indiana.
Awesome. I know, Karen, when we were having this conversation, you also had some ideas of how you fund some of your programs and things. Can you tell us a little bit about how we could pay for programs like these?
Yeah, so thanks, Adam, so much for sharing that. You have an amazing program. One thing, and Adam, you had said was the partnerships aspect. So I think partnering like with that health system that's local to solicit a grant because that partnership can help propel the programs forward. Some things to look at too is look at community reinvestment dollars through local banks, and you can talk to the local investors there. Talking with local foundations too, because they have very specific criteria often for what neighborhoods or areas they would like to fund. And some of these programs might fall into those areas just because they might be trying to increase the longevity of people. So if you can partner with them and um, show the effectiveness, you can pull down dollars from there. I was also just thinking like there's other places to think about partnering, like Habitat for Humanity is often going in and retrofitting things for older adults or folks with disabilities, or also just getting new homeowners in to homes. So kind of thinking about them and talking with them about their processes and also maybe how this might be a partnership to get some of these older homes that folks are in um, up to higher health and safety standards. So, Chip, did you have any other comments?
No, I would echo that the partnering with outside organizations, because I think the challenge that we always had was that you may have needs on the utilities may be really good at doing the energy efficiency portion, and there's a lot of dollars that are available, but to the point, there's often things that go beyond that need to be done for that household. So I think leveraging and working with organizations that may already be in people's homes that are doing the assessments that can then say, we can pull in the energy efficiency piece. I think even working with health systems, we send a lot, more so, especially post-COVID, we're sending a lot of folks more out into people's homes where we've got home health workers, we've got folks that are doing, we've got at Henry Ford, for example, we had a mobile paramedic unit where they were inside people's homes post-surgery to look at risks. We can leverage, we have a lot of maternal and infant health programs where we're in people's homes, where we have community groups that are in people's homes, where they can do some of that initial assessment and say, this home might be right for doing that, where you don't have to necessarily spend a lot of extra money to send more people out. You already have folks in where you can extend the training and do part of that. So you can leverage the existing programs and relationships by maybe adding a little bit more training here and there that can then extend your reach. And then, again, partnering with those organizations who have a similar mission so that you can offer the full kind of comprehensive suite of services that the patients or the clients really need.
Yeah, I would add to that as well. Like, I think for us, the first step was really understanding who is out there as a potential partner, right? And really kind of doing the legwork to see who's in the community, what are they doing, is there opportunities for collaboration, and starting that conversation. And I will be honest, I think when I first started this process, I was a little naive in how I thought, I didn't think it would be easy, but it has proven to be a significant investment in time and effort to kind of go out there and start to have these conversations. But that really is the critical first step, is to identify who are the people you need to be having the conversations with, and then starting those conversations.
Yeah, so I have more questions, but more importantly, I see questions that are rolling into the chat. So we're going to take a pause from the questions that I have, and I would love to have us answer some of these. So the first question is, 2023 and 2024 savings are actual usage savings, AMI data, question mark. Is this in a year period? So I think that's directed at you, Adam.
Yeah, so that those are deemed savings from the measures that we're able to do. So one of the things that I've tasked our program manager at CLEAResult with is to let's follow these customers, and then at the 12-month mark, at the 24-month mark, let's go back and actually look. We're fully AMI deployed in our territory, so we can actually go back and see, like, how is this measuring up with what we anticipated and what we deemed. But our programs are based on deemed savings. That's how we're evaluated. So, but there's plans to kind of conduct that follow-up afterwards.
Awesome. And then someone else is asking, would you have examples of energy savings achieved through Healthier Homes program from non-weatherization measures?
So, I mean, I think kind of like what I had alluded to earlier, the duct cleaning, right, that we do, like, there's no necessarily energy savings associated with that. I mean, you could argue that there may be a little bit. Cleaner ducts are more efficient in air distribution, but without doing that, we wouldn't be able to air seal or duct seal with AeroSeal. We've seen that we get about a 200% greater savings achieved through AeroSeal than through traditional duct sealing, right? So we could do traditional duct sealing for that customer, right, and achieve a nominal savings, but we know that we can probably get, between, double, sometimes triple the savings. And so the duct cleaning itself, no energy savings, but what it unlocks behind it is where the energy savings is. I think too, like, as I alluded to, the improving the health conditions in the home for customers with breathing issues, like, we may provide them with an air cleaner, an air purifier. That no energy savings there, right? We're going to give them an Energy Star one, so it's as efficient as possible. But what it does is it reduces their visits to the doctor and reduces their asthma attacks, so that they're more able to schedule additional services with us. Because, to get the full suite of services, it's a couple of visits, right? And we've seen that those often, with people with health issues, those get pushed further and further down the priority line.
Well, and to piggyback on that, I think one of the things that you might want to think about is partnering with either health systems or insurance companies, health insurance companies, because at the end of the day, if you can identify folks that may have unhealthy conditions within their home, and you can save the money of the reduce the number of visits that individual or that family has to the emergency room in any given year, that's substantial savings to the overall system. So as we look at that, really thinking about being strategic and working with those partners, whether it's the health insurance companies, to say, let's look at those individuals who are presented to the emergency room with asthma on a regular basis. Maybe there's some issue that's occurring within the home, and there's some savings to be had there where, you might have some shared savings. The other thing is all health systems, all nonprofit health systems are required to conduct a community health needs assessment of their community. It's part of the Affordable Care Act that got passed a while back. So all health systems have to conduct a community health needs assessment, and they post it on their website. So being able to look at that, you could go to the health systems within your community, look for the community health needs assessment that's on their website, and see what their priorities are and see what partners they're working with, because they do post those. And those might give you some opportunities to see who's doing some of this work, or, whether it's healthy homes or other types of community work where you might be able to partner, just to give you a start of who you might want to reach out to. Your local United Way, which is where Rebecca used to work at one point back in the day. They are very connected to a lot of the nonprofits that are doing some of this work too, that you can start to lean on to partner with going forward.
Yeah, that's great, Chip. I'm really glad that you mentioned that, because it is all about partnership, right? When we talk about implementing a program like this, because we are impacting health, we are impacting community, we are impacting a person's ability to breathe, right? So Adam, all the questions coming in are for you. The next question is, are there any other requirements to participate in your program? So for example, must you be diagnosed with a respiratory condition? If so, who does the validation of diagnosis? Or is it all just income qualification? That's the question they're asking.
Yeah, so it is just based on income qualification, right? We don't currently have a framework in place for us to qualify. We will go through our checklist, our Healthier Homes checklist, to check for those environmental triggers and indoor air quality issues, and that's kind of how we determine, you know, what needs to be done. We do, always try to accommodate any referral that's coming through from our community partner network. But as it stands, for our income qualified program, it's just the income as the threshold, right? So, you don't have to, we don't have to see your doctor's note, or you don't have to show us your test results to qualify. If we observed, we have trained, auditors, and it's based off of BPI's, standards, their healthy home standards as well. So when they're in the home, if they identify these issues based on their certification and training, then we're going to qualify the customer.
Yeah, awesome. Great. Um, and then the next question, this is a long one, so bear with me. It says, what is the actual determinant for when a project is, quote, too much and needs to be walked away from? Is it overall cost or savings, or the ability of the program allies to deliver on the customer needs, the health and safety needs? Is there any path to put those customers in connection with other organizations that might be able to mitigate their health and safety issues and then bring them back to energy efficiency for program offerings?
Yeah. So absolutely. That is essentially the process by which we do that, right? So we look at the overall scope of the work. We'll look at, is the cost justified in terms of the savings potential that's there? For instance, like we're not able to replace a customer's roof, but if we're able to do some spot repairs on the roof so that we can get in and insulate in the attic, and the insulation's not going to get wet, then we could do that. So we will look at what other funds are available for these specific issues with maybe partner organizations or other programs and services, and definitely like where we're able to plug those dollars in, we certainly will, and then refer customers to those, and then finish up with our services once we're able to. And I think that the key component of this as well is, when you're involving other organizations, is to be present with the customer, over the phone as needed, to kind of hold their hand through the process. Because the last thing we want is for somebody to fall through the cracks when you're looping in other programs or services. So I
Yeah,
hope that
that's
answered the
great.
question.
Yeah, I think so. I think so. And then someone else is asking, do you have any electrification programs or measures that incorporate health? And how do you compare in participation to energy efficiency?
Yeah, so we currently don't have any electrification programs. So that's not something that we necessarily look at. We support customer choice in those options, and so we incentivize, through rebates, et cetera, for options to choose electric appliances. But we don't advocate for fuel switching currently. So.
Yeah, that's someone else asked a question about fuel switching as well, so I'm glad that you just addressed that. I think we have enough for one more, and this one might be more for Chip and Karen. It said, would the cost of health insurance increase for participation in a program like this? And I'm not sure you'll have the answer, but
The cost of health insurance should not increase for participation in this. In fact, if anything, it should go down theoretically, but that's a lot of factors that go into health insurance rates. But theoretically, if you're reducing conditions that are going to lead to chronic conditions, and you can help to address the chronic conditions, healthcare or health insurance costs should go down. So I don't see any that fact. I think as more health insurance companies, should be looking at programs like this to identify those patients that are utilizing an extraordinary amount of care in more clinically inappropriate settings. So using your emergency room over and over and over again, or continually having readmissions, those should be flags for maybe we should go look into the person's home and see if there are things that we could do to address. And that's why we have the social determinants of health screening tools as well. But we also know that not everybody self-identifies, for those needs. And that's why when we have programs where we're actively in people's homes through whether it's maternal and child health programs or other home health care programs, whether it's home dialysis or whatnot, we could do some basic training around those individuals to be able to identify potential opportunities and opportunities to refer them to some of these types of programs that could help address their underlying conditions.
yeah, so I'm really glad that you said that because we ran a program of healthier homes here in Michigan, and we actually worked with a respiratory therapist who was referring his clients to us when he knew that they were low to moderate income and needed help with weatherization and things in their home that he felt like they could benefit from the program. And he absolutely loved the fact that he could come back to us and say, hey, I know that you helped this customer blank because they've now come to the ER like 3 times less than what they used to, right? So when you're talking about um, health insurance rates going down, like that would be an example of exactly what you're saying, right? Like in theory, they should go down because that would be less strain on the healthcare system because he's not going to the ER anymore. So, well, I want to thank you all very much for joining us today and giving your insights. I really, really appreciate that. If there are any questions that we did not get to, we can send a follow-up email. I really appreciate everyone's time and questions and engagement today. Um, Let us know if you need anything. I do want to remind you that we do have our energy forum coming up, and thanks, Nick. He's posted that if you have any questions, you can email brand@clearresult.com and they can answer any questions. And then also there will be the webinar will be posted in about a week, he said. So thank you all so much for joining us, Adam, Karen, and Chip, and everyone else. Thank you for listening.